It is my absolute pleasure to introduce our next speaker. Barb Finch is the Director of Children and Adult Networks for the Santa Barbara County Department of Social Services. She facilitates communication and collaboration across sectors and disciplines, engaging in a wide array of community stakeholders to collectively address challenges and improve outcomes for residents of all ages and abilities. Her leadership responsibilities include the Kids Network, Resilient Santa Barbara County, and Child Abuse Prevention Council, the Network of Family Resource Centers, and the Adult Aging Network. Barb, good morning to you and welcome. We look forward to hearing your presentation. Come on up. Can't wait to hear more. Thank you.
Well, I don't know about you, but I'm just really feeling the happy vibe. This is great. What a wonderful start to the day. Thank you. My name is Barb Finch. I'm here today with my Kids Network hat on behalf of the Kids Network to introduce the Children's Scorecard, which you all have a QR code that will take you to this, as well as a webinar explaining all about the scorecard. This will be a really abbreviated light touch this morning. So let's see, let me make sure I can get the clicker to work. There we go. So Santa Barbara County Children's Scorecard is produced by the Kids Network, which is a county-wide cross-sector network that was started by the Board of Supervisors in 1991 to advance interagency cooperation and to advise the board on issues related to children, youth, and families. It was first published in 1994, and the scorecard's been a cornerstone resource for understanding the needs of children and youth. Its purpose has always been to inform and align continuous improvement across sectors to ensure that children are healthy and successful. Contributors to the 2024 scorecard included content experts and leaders from over 35 organizations that came together to reach consensus about what was important to measure and what was important to communicate in order to see about the well-being of not only our children and youth, but our communities as a whole. So they worked to achieve consensus about the indicators and measures that would tell us. And then they also looked at the underlying conditions that might give us a clue about why those outcomes and the system of care look the way that they do. As you begin exploring the scorecard, there's a few things that we'd like you to keep in mind. First, we encourage you to approach the scorecard with curiosity and compassion. When we share data, the intention is for you to use it as a flashlight to illuminate what you're seeing in front of you, not as a hammer to condemn or point fingers. So it's important to remember that. If we're going to understand the data, numbers don't tell us everything. So it's really important to engage with families, to talk to families, and understand what are the reasons they make the decisions they make, and what are the things that are influencing the outcomes that we're seeing. Second, we want you to be aware that we're most often reporting data at the county level, and we know that this masks regional differences and also racial and ethnic disparities. And those are really important to look at, so they're worth investigating. We haven't provided extensive data breakdowns because we know that people have different interests. And so instead, we've left pathways for further exploration in the appendices. So all of the indicators, the measures, the data sources, all in the appendices. So if you're interested in a particular indicator or measure, you can go there and find the pathway to get that breakdown on the data. We also wanted to point out that sources of disruption have existed that affect our data and our trends. Beginning in the spring of 2020, of course, we had the COVID-19 pandemic. When we first thought about this scorecard as the post-pandemic baseline, we know that there were significant reductions in services that were modified to virtual formats, lots of changes, and that the data that we're seeing in 2024 may be a reflection of some of those issues. But moving forward, we're also contending with some dramatic policy changes, trauma in local communities, and impacts to the safety net for some of our most vulnerable community members. And so we know that going forward, our data may in fact reflect some of these issues as well. When we set out to create the scorecard, we wanted to identify some outcomes that would tell us how children and families are doing. So you'll hear more about this. But so we looked at the child, we looked at the family, and then we also looked at the system of care. So what does it look like? Are there adequate options for addressing challenges? How are we connecting families to the supports that they're seeking? It's important for us to understand that system. And then we also wanted to look at the conditions for raising children. This is an idea that came out of public health, that there are lots of other factors that affect health and well-being besides just going to the doctor. So we looked at the conditions for raising children as an indication of how we're doing. So taken together, this model shows a theory of change that says that outcomes for children and families will be positive if the system of care for families is effective and conditions for raising children are healthy and supportive. The same components were used to organize the content in the scorecard. So first, we'll look at outcomes. The scorecard committee decided that there were three essential outcomes that we wanted to look at more closely. So first, families. Our families are nurturing and stable. The second outcome, children are healthy and successful. And then the third, that fewer families require child welfare and juvenile justice services. For each outcome, we developed a list of indicators and then looked at the data that would tell us how we're doing on those indicators. We created an infographic to give a snapshot of some of the highlights and a narrative about what we learned. And then the appendix contains a full list of measures and the data sources for 34 different indicators. Some of the things that we learned are highlighted on the slide. And I'm not going to go into it because we have a limited amount of time. So the committee identified a number of important, The committee identified a number of important areas where there just isn't enough data as well. So this is what we do know. And then we identified things that we don't know. So we didn't limit ourselves to indicators that we had data. We wanted to identify the areas where we need information in order to highlight that as well. So in some cases, we have data at the state or the national level, but we don't have anything at the county level. In other cases, we have data about people who have public insurance or Medi-Cal, but we don't have any information about those that have private insurance or those that have no insurance at all. We know that sleep is crucial for children, but we don't have a way to measure whether kids are getting enough sleep. We know families need help, but we don't have a measure of whether families are accessing support services consistently. We have some sense of this from our family resource centers and from other organizations that are connecting families to resources, but we don't have a systematic way to track and measure this data. We also need better data about whether children are being screened for developmental milestones at early ages, when parents can provide extra support, or if developmental challenges are most often being discovered after children are in school, when interventions are more challenging. We need to know if kids are getting appropriate screenings and follow-up services. So this lack of adequate data calls us to figure out how to shift practices to begin collecting information in some of these key areas. The second section of the scorecard addresses the conditions for raising children, the different factors that affect how families raise their children and what challenges they might face. There's a significant interdependency among these conditions, and we need them all to get a complete picture. So we identified multiple indicators and data sources for each area: economic stability, healthcare access and quality, education access and quality, social and community context, and the built environment of neighborhoods. There's detailed information about the measures and the data sources for this in Appendix B. Next, we began to examine the system of care for children and families in our county. We visualized the system in two different ways. One, as a continuum of programs and services that promote safety and well-being, designed to support families according to their needs, and also as a system of interconnected parts, each essential to the whole, working together to ensure that the continuum operates effectively. The system is a loosely connected network of organizations and institutions, and it includes assets in our community that support all children, as well as services that are specifically designed for families who face challenges, and then also has intensive supports and protective care for children who have been exposed to harm. So as we examine the system, we look at the sectors involved, the referrals that are made between organizations, how navigators help connect families to services, and then also the funding that supports the work, and then networks that support the connections among organizations. We asked our stakeholders to identify areas for celebration Cross-sector collaborations emerged as a key theme, as well as the fact that we've elevated diversity, equity, and inclusion at multiple levels. We may need to adjust our language or shift approaches, but there's a genuine commitment and a dedication to fostering a sense of belonging for everyone in our community. We also asked stakeholders to identify some critical needs, and the three key areas emerged: workforce shortages, the need for data infrastructure, and the need to emphasize positive childhood experiences. So workforce, we need a coordinated county-level response to address some shortages. We know that housing costs and childcare not only impact community members, but also the people who are providing care to our children and families. We see a need for continuing advancements to create a data infrastructure that facilitates coordination and accountability. And while we've spent a lot of time across sectors learning about adverse childhood experiences and discussing the impact of adversity on outcomes, we know that the potential to influence positive changes in the future. And so focusing on positive experiences, each of us has the power to create positive childhood experiences that'll help mitigate the impacts of toxic stress and contribute to community health overall. Because Kids Network is an advisory body to the Board of Supervisors, we originally framed our recommendations as the recommendations to them, to the board. But we know that raising children is a collective endeavor, so these recommendations are also relevant for leaders of all kinds. And we all need to understand the most important areas for action. The recommendations focus on improving economic stability, working across county departments to ensure a no wrong door approach, increasing investment in North County where we know the needs are the greatest, and then also addressing those workforce issues. Data infrastructure will be an ongoing conversation that will benefit from a unified approach. In response to our current challenges, we also developed additional recommendations to help us stand together in community. We want to understand that families are losing access to services and supports that they need, and that stress within families may make it hard for children to learn and self-regulate. We need to take initiative to foster those positive experiences and supportive relationships. These are critical. And do our best to support one another. And you're going to hear a lot about that today, I'm sure. Learn about the services in your community and stay abreast of changes. Know who those organizations are that can provide the assistance to link families to resources. And then, most of all, honor the resilience and the fortitude that we've built and that we've grown from the past. We know that investments made today, whether it's time, money, talent, energy, love, investments made today can enhance conditions for raising children, improve care coordination, and create opportunities that lift up families, shaping the future of Santa Barbara County for generations to come. By working together, we can build a brighter, more equitable future for children and families in Santa Barbara County. As we close, I just wanted to share an opportunity for learning and connection. We're hosting a series of virtual gatherings designed to highlight partners in the system of care. And you can register for that series using this QR code. And I believe it'll also be in the resource packet. And so thank you so much. And feel free to reach out if you.
Thank you so much, Barbara. This is fantastic. And truly, the content that you shared really extends so much further beyond just Santa Barbara County, and these resources can really be used beyond that as well. So thank you. What you shared with being data-driven is so valuable. So often, oh gosh, this clicker and we're having a great day today together. He's like, use me. I'm like, I don't have slides for you. It's on presenters. All right, having this network of support really reiterates why we're all here today. We all play such different roles, but it's the collaboration that really brings us together. And then having the data to back up why we're doing this work really strengthens what we're doing. And you said something that I tried to write down as quickly as possible because I went, yes, that's it. Each of us has the power to positively shape the successful outcome for children. And Kat, who I'll introduce next, and I just talked about that this morning, that we do believe that we have the power to do just that. That's why we're here. That's the calling that we have. And so to have you talk about that today it just really hits that that's exactly why we're here in this room doing this work, is because each one of us, in whatever role we play, has the power to do just that. We watched a video yesterday about that why, right? And that power of doing this work. And what you've shared today really hits on that it resonates the same way, that we each have the power in whatever role we have to positively make those changes. So thank you, Barb. What a wonderful collection of data. The new bi-monthly series will really, it's a great resource for the community. I'm sure it's open to those outside of the county as well. So a great resource. Remember to download that. It will be in the packet, and people can learn more about the series across the county and across the state as well. So thank you again for sharing that.